So today we are going to discuss, there's a panel discussion. I have four eminent panelists with me. And Mr. Dr. Ishwar Chandra, Mr. Raja Pallari, Professor Bapi Raju, and Sharad Maheshwari. So these are the panel members. So the idea is we will be just going as we go along with the slides, and the panel discussion will be going on. So I'll be asking a few questions to the panel members, and then, of course, the panel members can give their insight, their thoughts. So why this panel matters? I think because multimodal is, at the moment, is imaging, pathology, genomics, clinical records, and finally it's going to be integrated one day. So that's called the intelligence system, integrated intelligence system. How is this transforming radiology and predictive and precision medicine and personal medicine? How is it going to change everything? That's what we're going to discuss today. So apart from detection, then it's going to predict, which we have discussed, and then personalize, because everything will be personalized to a particular patient. And that's why we're getting involved into genomics. So we do the gene typing of the patient. For example, if I'm taking a chemotherapy drug, that drug will be effective on me and may not be effective on another person, the same drug for the same cancer. So that's called personal medicine. So that is possible only with gene testing. So that's genomics. So just to put this in a very simple way, and prevent, how to prevent. So the main focus in the future is going to be personalize and prevent. So the idea is probably by 2050, the diseases should be significantly less because we are going to pick them up early and we are going to personalize it and we are going to prevent them. The radiology is evolving, as you can see. So instead of looking at images, it's biology and now prediction, and we can forecast a disease. The power of multimodal is the clinical context. That's the most important thing. So the patient becomes a connected digital ecosystem. That's the word. So the patient is not seen as a person. They are a connected digital ecosystem. And the future is personal. Future is personal. So remember that. It is not going to be, what applies to him is also going to apply to the other person. That's why you might have seen in cancer, some patients survive for the same stage 2, and some patients don't. Okay? So some patients don't, and some patients do. It's the same staging. So that's purely because of genomics, the way the patient reacts, the way the patient responds. And we are going to improve the quality of life. The 5 big questions, which I'm going to ask my panel members now, is, will radiologists become clinical intelligence specialists? Go ahead, please. You can take turns or whatever you prefer. Have a mic.
Yeah.
Yeah, you can face the audience, whatever.
Is it better, or we can do the same thing? We can sit.
No, it's fine. You can be seated. It doesn't matter. It doesn't matter. As long as they're able to hear you.
Yeah, so will radiologists become clinical intelligence specialists? I think very much. In fact, because as radiologists, we get connects from, say, cardiology, oncology, pulmonary, every branch, where a cardiologist is working in silo in his own cardiology thing. So we understand, in fact, if there are 3 GI surgeons in my hospital, I know which one is good for rectal cancer and which one is good for upper gastric cancer. So that kind of knowledge radiologists have. So definitely, I see radiologists evolving more in as intelligence specialist, plus as a orchestrator and administrator for the hospital as well.
Yeah,
So
that's right. Your views, Ishwar? You can go for the second one.
Yeah, I think that's already probably happening with genomics and radiology. You're able to predict diseases much in advance. I think imaging would play a major role in terms of identifying and predicting those types. I think it's already happening.
Most important is the scan will be normal, but AI, predictive AI, will still be able to tell you that something is going to go wrong soon. That's the difference. The disease takes time to appear on a scan, but it's too late. So we need to catch the disease even before it appears on the scan. This is the basic bottom line. If you get to understand that, so we're not going to purely rely on imaging. We're going to do the genetic testing. We're going to do the cell typing. That's what we do now. So I work at Great Ormond Street Hospital. There we are catching everything at a genetic level, even antenatally. We catch everything antenatally, and we can tell that this child is going to have a neuroblastoma. This fetus is going to have a neuroblastoma at birth. The first 3 months, it will have nothing. So that's the level of science advancement.
Shiva, I think the first question, intelligence specialist, we always have been clinical radiologists. Like you always had clinical, you are integrating clinical medicine, pathology, genetics, everything. I think that would continue and maybe you'll become better at it.
Yeah. So then now to the third question. So Professor Papi, please. Will foundation models replace hundreds of AI tools?
Yeah, this is interesting. I'm not going to answer that directly, but I'll give you my reading of the field. Interesting differences in how AI became general versus how doctor became specialist. Right? You look at the course of their training. You are an MBBS, you are sort of master of all, whatever, jack of all, kind of. And then you specialize, you become a radiologist. And so AI has taken a different evolutionary path. You had disease-specific, condition-specific models, and then evolution is toward a general foundation model that can be now specialized for. So, interesting sort of what is the underlying representational structure if you follow one path versus the other. I mean, that's not clear, but it's something that I find it interesting to think about.
Yeah, there is also a fear of loss of cognition, whether the doctors will be de-skilled. Thinking process, will it be wiped out completely by AI? Now, I was telling Ishwar yesterday, the younger generation, they can't look at an analog watch. They need a digital watch. Life is easy, right? Getting easier. But the problem is, who will multiply, 5 days, that, waste of time. Now, it's the same thing is going to happen. Cognition. Are we going to get de-skilled? There's a big paper going on at the moment. And we are working on it with the children at the Great Ormond Street Hospital. It's a huge survey we are doing. And on top of it, the mobile phones, they don't help. They don't help. They're growing up too early. A 5-year-old child behaves like a 10-year-old, but they don't know the basic mathematics. So we are completely messing it up. We are messing up the younger generation. I'm not sure how many of you agree with me.
We'll ask Mr. Raja his opinion too on cognitive decline or cognitive decay.
Right. Raja will definitely throw more light on that.
So there are a lot of cases we look at radiologists and observe and gather something, but there is something other way around. Software engineering also has been facing this issue quite significantly. You talked of de-skilling. There is something that we did come across called as never skilling. The newer generation doesn't go through the struggle that the previous generations have gone through in solving a problem, in dealing with it, in learning enough and associating and develop that relation adequately enough to kind of solve the problem. Now, which means that, hey, you are not skilled enough, first of all, to be able to solve the problem. Now, that's a real problem that we are seeing, that even folks from IITs that we engage, they seem to lack the approach that is required to solve a problem which appeared very basic. Now, when I have read the never skilling problem, I did read that in the context of clinicians, but then I thought that, hey, this is actually happening and we are seeing it on a daily basis with the engineers that we are working with. So I think De-skilling probably true, but I think I'm more bothered about never skilling these guys, the new crop. What if they are never skilled enough to deal with it?
With due respect to the younger generation sitting at the back, I'd like to have a very frank and bold opinion from one of you. Who's the youngest fellow here at the back? Please. You're not anti-Gen Z, right? You're not anti-Gen Z. Don't blame us, please, tomorrow. Don't go and say that panel was horrible. They were nasty to us. No. We are nice to you. But we are worried about you. We are concerned about you. Yeah. We don't want to blame you. We're concerned about you. Somebody, anyone, please, feel free. Volunteer yourself. I want to know what's going on in your mind, please.
Yeah, so in defense of Gen Alpha,
Okay. Fine. I don't want to go there. Because that's next step. Right now, Gen Z.
okay, Z
Yeah.
plus Alpha.
Go on.
So I feel, I think putting the onus on Gen Z and Alpha for the kind of evolutionary exponential evolution that's happening, that's a bit too much, right? We have responsibility as whatever, you can go all the way to boomers, that we have the responsibility to make them adopt to these changes. I think so. We are in a position to see what you would miss if you go on this path. So that means we need to wake up, I feel, from, we have learned implicitly. We have gathered a lot of knowledge from society, and we had the time, right? And we had the space. And those are not available. Then you have to do an experiment, mental experiment. So how would I allow these people to, what sort of environments should I create that they also gain this, that we could do it implicitly and automatically.
Perfect. Thank you. Anyone, please answer my question. Anyone, younger generation, please vent out your feelings. Don't keep quiet. If you keep quiet, the elders will destroy your future.
What was the question? Could you repeat that?
The question is, are you guys happy with AI? Do you think that's going to take away your cognition? Yeah, go on. Be very brave. Don't try to be diplomatic. Be very brave and bold.
I'm Dr. Srinivas. I'm a final year radiology resident. I don't know if I'm the youngest of this lot, but I'm surely from Gen Z.
That's fine. You're very young. Go on.
I'm surely from Gen Z. You asked me to be brave, but actually I'm very scared about all these things. It's very overwhelming to me. And I don't know if this never skill thing, if it is coming across as an arrogance or not, but it's still it's actually a confused state for the Gen Z people. I don't know if I'm talking for everyone, but for me personally, I've been here since yesterday, but this whole thing is very overwhelming, and I don't know where to start and where to end is a very long thing, but I don't know where to start to understand all these things.
Do you feel quite drowned?
Yeah, drowned and.
Yeah,
I'm
I think that's what most of my medical students, they tell me. I teach at King's, Imperial, UCLH. All my medical students, I feel sorry for them. They come on a Saturday and Sunday, attend lectures. I never seen medical students so dedicated. 7 days. They're coming and listening to us. Please teach us AI. I'm very worried about my future. I don't know what AI is going to do. I think as elders, we are failing the younger generation. That's my honest feeling. I'll tell you one example. Thank you so much. Have a seat, please. I'll give one example. Anatomy is all come on AI now at Imperial College. When I teach radiology to the year 1 medical student, just give basics of AI, radiology. You know what? Their anatomy is in bits. There's no continuity. There's no continuity. You ask them about brain, they'll say, I only studied medulla oblongata. Scary. Very scary. You ask about the long saphenous. The long saphenous, I can tell you about the thigh course. That's all. What happens beyond that? Nobody knows. Now, these people are going to become doctors and they're going to treat. Are we doing justice? I think we are failing to lay the basic foundations, which exactly Professor said. We are not doing that. It's going to be a disaster. Imagine, already if you come to UK, with due respect to all my GP colleagues in UK, the GP colleagues are all the time looking at the computers. They don't even have time to look at the patient. The patient is sitting here. And the moment you act, the GPs are given only 10 minutes. The GP will say, okay, come on, what's your problem? And they start Googling. They go on AI, Copilot. Okay, I've been having back pain. How old are you? Oh, I'm 16. I've been having this for so long. Okay, the Copilot. What is the best investigation? I'm seeing the younger GPs like that. They even don't know which test to request. They say, yeah, I did PLAB, I did an MCQ, but I didn't get that question right. You can't be given 4 choices when a patient is sitting next to you. You can't be taking true, false, or scratching your head.
Shiva, I think the question is what they are confused is
No,
what should we do?
No, I'm coming to that. That's why it's quite a winded answer. Yeah, long-winded answer. So what you should do is, you know what? What we are trying to do, we are writing the curriculum now. So I'm involved in the curriculum. So please insist, ask your professors to write a curriculum, keeping AI in mind, but ensure that AI doesn't do all the basic work which it's supposed to. You must learn certain things. There's no question about it. You can't straight away sit in a driverless car. You can't call yourself a driver. No. In London, we have driverless cars. It's an absolute disaster. Absolute disaster. I don't believe in all that, high tech. When you have taxi drivers going out of job, why do you want a driverless car, especially in a congested city like London? I don't get it. Probably because some of the high tech companies, the big tech companies have some financial gains, but who cares? People are going out of job. Youngsters are losing jobs at phenomenal rate in England. Phenomenal. No one is getting a job. Everyone is doing 2 jobs, part-time job. They're studying and they're doing part-time job.
Shiva, you're scaring the people. 2 jobs, they're losing jobs and then doing jobs.
I'm not scaring. I'm making it more engaging. Yeah, I'm a veteran in this. 40 years I've been doing this. So
No, I think
I'm not a novice. Anyway, let me jump on to the next one. Could imaging become a non-invasive genomic test? Could it be a non-invasive genomic test? Please. I want it more interactive. Come on, guys. Give them some work. Ask them questions. Ask some questions. I'm sure most of you have some burning questions.
So,
Okay, so...
one thing which I'll say. I mean,
Okay,
I don't know.
Raja, let me know, what do you think about this one, this question? Could imaging become a non-invasive genomic test?
I'll tell what I know because that topic is a little too deep for me to talk in depth. But what I know is that radiogenomics is an evolving field. The multi-modality where you are combining the different aspects of imaging, of clinical stuff, of pathological information, genetic information. I think if radiologists, I've heard earlier that radiologist is going to become center. That gives us a great chance for different modalities to be brought together for the system to become a lot more intelligent. So that is very likely happen. I don't know if radiology alone, imaging alone, can become so smart that it can avoid the need for biopsies and genomics.
I see it's called digital biopsy. I'm not sure how many of you have heard of it. It's called digital biopsy. Radiology doing biopsy.
I don't think that's going to happen, Shiva, because you need tissue
there was
for markers.
There was a presentation in the tech exhibition, and the audience, there were so many surgeons, they got so mad at the speaker. He was literally manhandled and removed from the podium. So I don't want to go there. The surgeons hate it. It's called digital biopsy. It's still there. You can go Google and check it. What parts of radiology will become autonomous first? Any guesses? Sharad?
For the previous digital biopsy, radiomics is like RCC can be clear cell carcinoma, chromophobe, or a papillary type. So radiomics is now able to tell you the histopathology type.
Absolutely. So rapid fire. We're going to finish. This is just the last slide. Rapid fire for all the panel members. So yes or no? Autonomous reporting?
No.
See? The engineers are hoping that you're going to replace us. No. Next, biopsy reduction?
No.
No. Human in the loop forever? Yes. Good. Will PACS survive?
Not in the current form.
I think it will. Yeah, it will be very evolved. Yeah, it'll be like you can be interacting with the
Picture
PACS.
archiving and
Yeah, but
communications.
still, I think you'll need something in front of you. Anyway, so India's biggest opportunity in imaging AI.
Data.
Data.
To be structured.
Absolutely. Even Americans and all the European countries, they are scared of Indian data. Scared. You won't believe. They're asking me, are you going to India? I said, yeah. I said, can you check whether we can get some used data from... I said, what? I can't. I'll give you some ethnic data. I'm going to get Asian data. You are Caucasians. It's not going to work. Anyway, most overhyped trend.
Autonomous reporting.
Autonomous reporting.
Yeah, another thing is LLMs can solve the whole lot of problems and AI is not required.
Thank you for that. I feel a bit happy now. And most underestimated breakthrough. AI is the most underestimated breakthrough? Or is it overestimated? Oh, you think so? Okay. So I'll be here again next year. I'll come back to answer this question. Yes, we can ask Professor Bhapi. Maybe he has a seventh sense. We'll ask him.
Well, I don't know exactly what the answer that you want me to give, but I'm thinking of the clinical workflow where you have, it's fascinating to look at tumor board sort of methodology where multidisciplinary teams come and debate. So I don't know, as a radiologist, I don't know what the neurologist report is. And so we are going into a surgical decision. And so people bring in their perspective from their limited, right? So and something like this where now you can think of AI as an additional person in that room sitting and enlivening the discussion, right? So those possibilities we should explore.
Absolutely. At least for a radiologist, it's seen as a companion. Yeah, companion. Yeah, that's a word I'll use. And radiology 2035, any predictions? Bold predictions, 2035? Where will radiology be? Not only in India, everywhere in the world.
Computational pathology, radiology will be one.
Okay. And Raja, what about you?
What I've heard is that radiologist is going to become the center of the hospital. I dearly want it to happen because these are the guys who understand AI the best, and these are the guys who we can work with the best. If they become the center,
I love this
collaboration
place.
would improve.
I love this venue. I love the panel members. Thank you very much, and I'll see you next year.